Good afternoon, Chairman and committee members. My name is Josette Saxton. I am the Mental Health Policy Director for Texans Care for Children. And I have to say I'm a little bit disappointed I'm last on the agenda, so I was going to say that you saved the best for last. So I will share that. And I think more sincerely, I truly appreciate the opportunity to be here to provide some recommendations related to kids and children's mental health. And I think it's appropriate that, and again, if I was last, I could say this, I was going to say, I think it's appropriate that we're going to end on recommendations looking at how we can improve mental health outcomes for kids. Let me go back to some of the testimony you heard on that first day where you were starting to dive deep into issues and you looked at children's mental health, and you heard from folks that's saying that half of all cases of chronic mental illness, symptoms first began emerging by the age of 14. We're talking young kids here. And then if you look to age 24, so we're looking more into young adults and more the adolescent years, 75% of mental health symptoms began to emerge. So really what this does is, this committee has done some great work in listening to all the different issues that the mental health systems, behavioral health systems span, all the different issues, all the different systems. If we really want to get at intervening early, I think we need to take a close look at what can we do while things are still beginning, so we can either divert kids from needing additional services as they get older, or mitigating the impacts that mental illness often has on individuals. I want to say that also the recommendations that I provided in your packets here too, they are informed by my colleagues within Texans Care who are also working and doing deep dive issues, not just on mental health. I cover mental health, but Texans Care for Children also looks at children's health, maternal health, child welfare, early childhood education, juvenile justice. So again, when I had this opportunity to speak to you, I tapped into their expertise in saying that, knowing that all of these systems really are serving kids and kids with mental health concerns and families that are raising these kids or kids with mental health concerns, what would you do to help really support the mental health of kids? And so the list that you have in front of you is really pulling on a lot of that expertise. And then the first one that I will draw your attention to is if you want to have good mental health for kids, we need good mental health for their parents, especially moms, especially when kids are young. The time, and not even young, even while they're in utero. And we heard testimony earlier today about the effects on babies' brain development when their mothers are using substances. And then also there's effects on babies' brain development based on the relationships that they have in early childhood. And this goes for all kids. When a mother is depressed, and there's postpartum depression, which has a high prevalence, which is not uncommon. It affects the brain development of the young child because, again, child's brain, the natural development is it's formed through relationships and through experiences. So one of the very first things that you can do as you're considering, well, how do we take all this how do you take all this information that you've heard and how can you put it into policy practice? What can you all do? I suggest looking at how can we improve mental health services, identifying postpartum depression, and making sure that moms have access to the services. As we take care of our moms, we're going to take care of our kids. I don't know how we missed it in this testimony, but the question earlier, thank you, Representative Turner, about ECI. ECI is a big part of the continuum of services when we're looking at mental health concerns for kids. The public mental health system, they start serving individuals at age 3 and up. Before age 3, if there is a delay in social emotional development, ECI is your system. That's where, again, we're providing some of that early identification and intervention so that, again, we can change the trajectory of kids that might have some early signs of social emotional development, which could then lead to mental health concerns. Also, I have to give a shout out to Mental Health America of Texas, and I know they've been doing great work around parents as teachers, a home visiting program alongside other home visiting programs like Nurse Family Partnership. And again, these are programs where we're helping to support young families, and by a lot of times home visiting programs are viewed as a child abuse and neglect intervention. They are very much so a mental health promotion, mental health prevention strategy also. So as you're making deliberations and where you're going back to your respective committees, whenever you're hearing about some of these prevention and early intervention programs, they might be in the context of child abuse and neglect. They are definitely mental health prevention and early intervention programs as well. The other strategy that I wanted to mention too, and this is probably the one I feel most passionate about, is looking at what can we do with our school systems? How can we help our schools promote mental health, mental well-being across all students, not because we want them to be mental health providers, but because we know that mental health impacts student achievement, and schools are recognizing this, and that's why they're searching out on their own how can they address the mental health needs of their students, knowing that it's going to improve the things that they're concerned about, things like testing scores, things like kids in their seats, attendance rates, dropout rates, graduation rates. So again, schools are looking for information and ways on how they can address mental health of their students, but the state really isn't. We have some pocket efforts that are going on, but it's not necessarily coordinated. I think I include some information in my testimony to y'all about saying that if we look at the infrastructure, there's a slight infrastructure there that the state can use. I think it needs to be fortified to really take advantage of it. But if we're looking at between the Texas Education Agency and the Department of State Health Services, they together form a school health program. There's one person at TEA that's dedicated to this, and that's all health and safety. And there is, I think, I haven't checked on it recently, but for the longest time there were 3 people at the Department of State Health Services working on school health. They're also working on obesity. I'm sorry.
No, I was just going to interrupt you real quick because I think I'd like to hear your opinion as you're talking about this as to whether or not, if the state were to initiate a more comprehensive or broad program specifically addressing school children, would that best be addressed at the ESC level for regions across the entire state, or at a district level, which is even getting, sometimes if someone's at a district level, they're more involved because they're right there than maybe an ESC that covers multiple counties, which could include dozens of districts. Just trying to understand, if you really want to try to affect something positive, at what level would the state have to get involved?
That is something that I really churn about a lot, is looking at, because so much of education is local control. It's not even district level. A lot of times, too, it's campus level. Each campus is like its own little fiefdom, it seems to me, when I've talked to people. So what can the state do? I think, yes, ESCs play a vital role. But the way, again, if I had my magic wand, I think what I would put in place is if we could just add a few more dedicated FTEs, folks at TEA, to sit and look about all these efforts that they currently have going on, and it's not real apparent, but they do have some stuff there. They have district improvement plans that are looking at things like dropout prevention, which there's a lot of mental health stuff going on in dropout prevention, truancy prevention, suicide prevention, discipline management programs. A lot of this addresses mental health concerns, or they impact kids with mental health or with mental illness that are involved in these types of, or served by these types of programs. So I think if we can get someone at TEA to actually take a nice inventory of what they have within their own house, to then figure out how can TEA better align and think about these efforts, not as separate projects, but then how can they all work together so they can leverage their resources more effectively and efficiently, and then provide guidance to school districts on how they could do the same if they want to. Not asking for any mandates, but I know there's schools out there that are looking for information, but they're just doing so on their own. Every time I hear about a school that's doing something, innovative, exciting, I'll always ask, what assistance have you gotten from TEA or the ESCs? And they usually just laugh at me. But I will say, but I don't necessarily, I don't fault TEA because I think they've been pretty bare bones. I'm very excited about the new commissioner and, hearing about how he wants to provide training and technical assistance and support school districts. I think that's definitely the way to go. I think then also utilizing ESCs because they're the ones that know schools. And schools are used to dealing with them. So I think using them for those districts that want to access those resources. So I think what's the role for the state? If we, and I have some more specific, more policy wonky things, in the recommendations here, but really having them look at how can we take our resources that we have, how can we use them better, and then also promoting effective practices to schools related to things like better serving kids with mental health concerns. What is the impact of trauma? I think it'd be pretty huge if we can have educators understand how trauma experience in childhood impacts a child's learning, their behavior, and then how that and then being able to, and then having strategies on how they could better educate children with a history of trauma. And there are national resources out there. There's a lot of information on what schools can do, but it might not be so easy for schools to access it. They got a lot of stuff that is on their plate. I think if we as the state could make it easier of pointing them to those effective practices that are school specific. I will say right now, the legislature a couple of sessions ago did require TEA and the Department of State Health Services to create a list of evidence-based practices or best practices related to mental health, substance abuse, and suicide prevention services for schools to make it easier for them. But if you look on there, a lot of the evidence-based practices that they point to are more clinical in nature. If I was a teacher that is struggling with how can I best teach the kids in my class, I'm not going to have the time to sit there and go through all of these different clinical interventions that aren't appropriate and they're not qualified, nor should we expect them to do some of these things. So again, if we could make it a little bit easier, I think that would be a great first start on how we can help schools. Another thing that I think is untapped, we have each district has a school health advisory council that is required that schools are to have, and it's a body that is made to provide recommendations to the school board on health and safety issues. Maybe not safety issues. I'm sorry I said that because I know my daughter's school district, they include safety in theirs. But again, I think it's a way that we can get community and parent input to help school districts think through some of these things about how they could better address students' mental health and really look at the whole child. Also, next one to move on to another sort of bucket area of opportunity is there are some things that we can do, that y'all can do, to improve the outcomes of kids in foster care that have mental health concerns. You've heard repeatedly, I know, the impact, again, of trauma on individuals' reactions and their development. I mean, almost by definition, our kids in the foster care system, they've experienced trauma. Whatever trauma they might have experienced through abuse or neglect, but then they've also been taken away from the only family they know, and they've been moved different places. So I think it's really a good idea for us to take a look at how can we provide better services, mental health services to kids in the foster care system. And I know I provide a list of different areas too. A lot of them, again, go back to the issue of trauma. If we can provide better training to our caseworkers, to our foster care parents, to pediatricians, to judges, anyone who's coming into the contact with the lives of kids in the foster care system, it will benefit them to have just a simple awareness of what trauma does, how it impacts children's behavior, development, learning. Too often these kids are just seeing it as acting out or being quote-unquote bad. It's trauma. Also, parents and caregivers need support too. These are, in terms of foster parents, birth parents, we need to give our families more tools also on how to respond appropriately and help kids who have been involved in the foster care system, help them heal so that they can go on and be successful. I know a big concern in my office, too, is between the number of kids that are involved in the Child Protective Service system and the juvenile justice system. a lot of the same kids. And I would say if there's kids that are involved in both of those systems, they might not have been involved in the public mental health system, but they probably should have been. I can almost guarantee that there's some mental health issues there too. How can we have, but again, just focusing on child welfare, juvenile justice, how can we have better information sharing to make sure that, we're serving these kids, who's, providing what, how can we make sure that things are done more efficiently and effectively, and make sure that these kids don't fall through the cracks. Again, within the juvenile justice system, one thing just wanted you all to be aware of, there was a regionalization bill that was passed, I guess it was last session, but it was a good bill in terms of kids that are in the juvenile justice system recognizing that they're best when they're served in their communities, not locked up and taken away from home. So the state is working on a plan on how they can serve more kids in the communities and not committing them to state facilities. And this is SB 1630. It also, from last session, it also said that a youth cannot be committed to a state facility unless they committed a felony, except if the youth has a mental health need that the community cannot meet. So regardless of what the offense was for the child, if they have mental illness that a judge determines cannot be met in the community, then we could take that child, put him in a state facility, far away from home. And that just goes against best practice in terms of we know kids do best, especially those mental health concerns, when they're close to homes, families, and supports. So those provisions of SB 1630 don't take effect until September 2017. I know there is a regionalization task force that's looking at how communities can do a better job at keeping kids in their communities. I think as part of that scan, my colleague who at Texans Care who sits as part of that service, she said that each of the regions said that they lack an adequate number of mental health services and substance abuse services within their region. So what I fear, what really worries me, is that we're going to be sending kids with substance abuse problems and with mental health, concerns we're going to be committing them to state juvenile justice facilities just based on their mental health needs. Again, not on their offense. That keeps me up at night. So, but what can we do? Let's build up our community's capacity to better serve these kids in their community so that they don't go down that path. Another area I wanted to mention too as an opportunity is we keep hearing about all these good things that our communities are doing. And how can we disseminate that information to other areas of the state? How can the state help to get that out? It's interesting. There is this government, there's already a mandate or a statute in code that requires child-serving agencies to come together and coordinate training to serving kids with serious mental health issues. And I think the statute says dysfunctional families, and I hate that word. But again, the issue was state agencies are serving these high-need population kids and their families. How can we do a better job of getting training for effective practices? So they wanted the agencies to come together, form a task force, develop MOUs, and figure out how they can get effective practices out there. As far as I can tell, it's not being used right now. It's not being implemented. What I see is that's an area where I think there could be some amendments to that statute to maybe bring it up to date. I don't remember when it was last used. Or what it looked like when it was implemented, but let's see what we can do to make it better. And again, to just try and get it's not even just effective practices, but then also making sure that one agency knows what another agency has available. I go back to that juvenile justice regionalization task force. It was, a little bit disconcerting to me when I heard that. I think everyone here has heard of the YES waiver, the Youth Empowerment Services waiver that's available through the local mental health authorities. Again, that's provide intensive community-based services for a child with significant mental health concerns. Juvenile justice departments didn't know about that. So as they're creating this, or the community departments, community juvenile justice departments, I don't know if I'm saying that correctly. Forgive me for stumbling over my words. But there were chiefs that weren't aware of the YES waiver, and I'm thinking they need to know about the YES waiver. If they're considering, if they're looking at eventually maybe saying, the community, oh no, this child has mental health needs that we can't meet here, they should be committed to a state facility. They need to know about the YES waiver first. We need to keep these kids in the community. And so those are even things. So in other words, to make sure the state agencies know, hey, we might not be able to offer this, or they need to know what the landscape is of available services that they can provide kids with the most complex needs. And I think I'm almost done. I know it's a long day. Forgive me, people. Also, two issues that I wanted to raise up. Earlier today we heard that Assistant Commissioner Sonia Gaines, whom I love, she's a wonderful woman, that she gave the case of there was a 13-year-old who had mental health issues, substance abuse issues, and the state agencies came together. I think this child was at risk of being relinquished to the child welfare system because of her mental health and behavioral health needs. But the state agencies came together and they figured out a plan and they were able to divert her. Why can't we do that? Why does it take state agencies to do that? Why can't we do that at the local level? Already we have in place community resource coordination groups. These are entities or mechanisms at the local level that are set up to do just that. If there's a child that has needs that can't be met by one agency, it brings community agencies together, it brings members of the community, it brings the family in, and they come up with a plan. They just try and troubleshoot and figure it out. Some communities or CRCGs are fantastic, other ones not so much, but they get very little support from the state on doing it, on conducting these CRCGs. I think this is a way that if we, and again, an opportunity is to look at how can the state assist local community coordination, CRCGs, forgive me, on serving families at the local level. We won't have to wait and get the state agencies to try and solve some of these problems. Also wanted to mention, too, I remember I was disappointed that this didn't come up in the initial hearing on children, but there is an effort that's going on in the state called the Texas Systems of Care Initiative. And really what it's looking to do is not necessarily to provide direct services, although it does help some communities provide some direct services. It's looking to transform the way our services act together to produce good outcomes for kids. Within the material they receive, I know there's a chart there that is looking at to see what we're trying to do. We're trying to move from a fragmented service delivery to coordinated service delivery. We're trying to keep, instead of kids being served out of home, let's keep them in home. Families, instead of viewing them as problems, let's view them as our partners, and who know the child's strengths and know what the child needs. And so again, it's this shift. So right now, the state is doing some pretty, what I think is exciting work on how we can get our systems to think differently. Right now, it's operating under a grant from SAMHSA. I think it was like a 5-year grant. I am very worried that once that grant goes away, that HHSC is going to step back from it. Already, the staff person that was charged with overseeing that systems of care effort, there was some change. The person who was there retired. When they filled a new position, they moved that, what I saw as a systems change staff person, over to contract management. And I'm like, no, this is not contract management. We are going to change systems. So what I would urge is that there are some effective things that are going on in the state. A trauma-informed care initiative is also going on through the Department of State Health Services, another grant-funded program. We need to make sure that once those grants go away, that we keep up the momentum of those efforts. And I will have to say right now there is a great conference going on here in Austin related to trauma-informed care. I know there's some folks that are very disappointed that they can't be here tomorrow, or it's going to be tough for them to come tomorrow in public testimony because they're heavily involved with that. But again, let's keep the state's good work going from those efforts. Lastly, thank you. We need to help our families that are caring for these kids. And again, going back to that hearing on children's mental health back last spring, we heard over and over again, I was struck by providers saying, you can't just serve the child, you need to serve the family. That families raising kids with serious mental illness, they are under such stress, they're isolated. Nobody's bringing them, a casserole over because their kid's sick. I mean, because of stigma, they're really isolated. One way we could support these families, right now, local mental health authorities have on staff, I think they're required to, under contract, a certified family partner. You've heard a lot about peer support services. When you're treating a kid, when you're treating a child, you can provide peer support to the family as part of the child's treatment. So you help the family, the mother, the parents, navigate the systems, being able to, advocate for your child, get support and feel empowered. And this is shown to have a huge impact on families being able to keep their children in their home. Right now, I mentioned local mental health authorities have them per the contract, but there's no dedicated funding stream for them. If we could open up the state Medicaid plan to make the peer support services available for the services provided by these certified family partners, that I think that'll go a long way to help empower families to continue caring for kids in very challenging situations. With that, thank you for letting me join you today, and I would be happy to answer any questions either now or later.
Thank you, and thank you for your written testimony. I appreciate it very much.